Welcome, everyone, to the Infertility Feelings podcast. We are so excited to be here today. My name is Doug Brown.
And I am Jessie Brown.
We are joined by one of our best friends in the whole world.
Yeah, in the whole wide world, right here. Or who I want to be my best friend in the whole wide world.
We are joined by Dr. Loree Johnson. Say hi.
Hi there. It's so good to be here and to see you all in person.
I know.
I know.
Finally.
We've talked for a long time, but it's now we actually get to sit down together and talk. It's wonderful.
Yes, air hugs.
Yes, air hugs.
Yeah.
We are so honored that you are here. Thank you for spending the time with
you.
us and telling us your story. We are honored to hear it.
Oh, thank you so much. It's, I've been big fans of yours since you first started your nonprofit and been following you on Instagram. And so thankful our paths have crossed and, excited to be here and to tell you a little bit about my story.
Yes.
Absolutely. Why don't we just jump right into it? And why don't you tell us about your story? Tell our listeners who you are. We met on Instagram.
Yes.
Mm-hmm.
So Instagram bringing people together.
Yes.
That's why I love it.
And also probably destroying our minds at the same time.
Yeah. Social dilemma.
Yeah. Yes. Social dilemma. Have you seen that?
Yes.
I haven't seen
Oh,
it.
man.
Doug just told me about it and I was like scarred.
Oh my goodness. It will cause you to get your life together.
Yes,
when
it
you
will.
think about it, but that's a whole nother conversation.
Yes.
Yeah.
Yes.
It was like
It's a conversation for another day.
I opened up Instagram after watching it. It felt like it was like peering into my soul and judging.
Yes.
Like, oh my gosh, this is terrifying.
Yes. Some serious protocols were put into place after I saw that.
Yes.
Yeah.
Notifications.
For sure.
That part.
Turning them
Scary.
off. Actually.
Yeah.
turning them off.
Yeah.
Exactly.
Yeah. Well, hopefully you got notified about this podcast, though.
I know. Hopefully you're keeping your notifications on right now for this.
Okay, so tell us a little about even like where are you from? What's the backstory? And then leading all the way up to what are you doing now? And you're serving the infertility community in so many amazing ways. Tell us about some of that too.
Yes. So people might know me on Instagram as Dr. Loree Johnson, but I'm a licensed...
Go follow her. Sorry.
And I am a licensed marriage and family therapist. I've been in private practice now for about 12 years. I've been in the field for 20 some years, kind of dating myself. But I'm originally I'm a Virginia gal. I'm a Southerner,
Awesome.
transplant, and I've lived in every part of the country except the Pacific Northwest and landed in LA about 18 years ago and have made a home here. Got married a little bit later in life. And
How did you guys meet, you and your husband?
So my husband and I met, ironically, in a motorcycle riding group.
Whoa. Wait, what?
Yes. So
There's layers to this story.
There are layers.
I love it.
There are layers. So don't let the calm exterior fool you.
Yeah, no, I love it.
I love motorcycles, and
Awesome.
probably when I was in my mid-30s, I went through this kind of time period after I got licensed. I finished my license, I got licensed and finished my dissertation all in the same year, and which I don't recommend.
Yeah, that's a crazy year.
It was a crazy year, and
That will drive you to motorcycling right there.
Yeah. Straight shot.
I felt like my whole life just turned after that. And so I realized I had all this free time and started to see other lady riders out there. And I'd ridden a little bit before, as a passenger, but I was just like, oh my gosh, I'm going to just, take a class. And lo and behold, I joined a group and my husband contacted me to go on a ride. And
That's
at that
so
point,
fun.
I didn't have my license yet. I was, I had my class scheduled. And I was like, no, if we're going to ride together, I need to meet you first. I'm not just going to meet you and jump on the back of your bike.
Yeah.
So
There's a protocol here.
There's a
I like
protocol
that.
here.
That's like an 18-year-old move. I like it.
Yeah.
Yeah, just like jump on the back.
Yeah.
You know? I like that.
So ironically, we decided to meet up and over in Laguna Beach at Las Brisas. That's where we
Yes.
rode
Yes.
to and had our first kind of first date, and that was kind of all she wrote. So we met.
So fun.
Yeah, we met riding motorcycles together, and it was a huge part of our courtship, and had so many wonderful memories.
I love that. Do you still ride motorcycles?
So I haven't ridden as much lately because of infertility. Which,
Right.
There it is.
Yes. And we can talk a little bit about the physical toll that it takes on your body. And, and so when you are operating that, heavy machinery, you obviously want to feel really present. And when you're not feeling present, it's not the best time to be on the bike.
Right.
So, unfortunately, I've had to be a passenger now a little bit more than I like to be, but Purple Rain, that's my bike's name. She's still in the garage.
I love that name.
I love that.
Yes.
We're gonna need to see a picture of Purple Rain on Instagram.
Yes.
pretty
Can we
soon.
just pop that up?
Yes, I
You
will
on the Purple
definitely.
I love that. I could not imagine seeing my therapist pull up in a motorcycle.
I would love that.
Would just
That'd be
be
awesome.
amazing. I'd be like, I'm in 100%. I don't even need to talk to you.
So what drove
Yes.
you to wanting to be a therapist, wanting to even just pursue that education? What drove you to that?
It was a natural progression. I was always a good listener, always, really compassionate and really curious about what's going on with other people. And so I think I connect with, people's hardships. And I have a wonderful gift of sitting with people in their most difficult moments. And
I love that.
I feel so much pride in that and, and just providing that sense of soothing for them. And so it's kind of like that professional friend, listener, and discovered my graduate program while I was still in graduate school. And this was all at Syracuse University in upstate New York. So if anybody's out there from New York, and went to a great program that really prepared me for the work that I'm doing now. I did start a little bit of my career in community mental health, and then decided to make the transition into private practice just for some more flexibility and wanting to do more of my own things. And that's where I started to work with individuals that were in the infertility community. I wasn't a part of the community just yet, but just because I was working with professional women who are now faced with these decisions of, I'm advancing my career. How do I manage that with finding a partner? And then, I'm having some issues with getting pregnant. And so those issues started to pop up naturally. And so
It's so common.
it is so common.
So common.
It is so common. And so seeing that time and time again gave me my first introduction to the infertility world before I became a member of the community.
That's so interesting. What did you? Can I ask you, what did you think about the infertility community before you were
good question.
even a part of it?
So I'd seen colleagues struggle with infertility, and I saw them talk about their
Can
shots.
I clarify? Was that other therapist you're saying?
Other therapists,
Okay,
yes.
okay.
Yes. So I saw other therapists going through their infertility journeys, talking about the shots. I saw them having to leave work to go to appointments, talk about the ultrasounds or whatever procedures. I have seen them try to practice while, they are, doing the stimulation medications and the toll that took. So it was tough to watch them go through it and to kind of go through the ups and downs and to see some successes or some failures. And so I saw probably people go in a few different directions, from foster care to egg donation and surrogacy to just, I give up and then they get pregnant naturally. So just seeing the gamut of what could happen, it was still a little trippy, for lack of a better way of describing it. Obviously I had a lot of compassion, and they were, very dear friends. And at the same time, it's quite different when you're watching someone go through it versus when you're also going through it yourself. And so while I think I, was very sympathetic to their experiences, once I and also sympathetic to my clients' experiences and advocating for them as much as I could as their therapist, it really changed when I started going through it myself, and I could see with my own eyes what the experience is like. So it changed the way that I, kind of coached people around talking to their doctor, knowing their information, being able to understand the information that they're being given, because it's a lot coming at you at the same time.
Yes.
And it's incredibly overwhelming. So when we feel overwhelmed, we don't really take in, it's hard to process information. So
I remember so many times the guy's talking and I'm like,
Right.
And I'm like,
right.
I'm not listening to anything you're saying.
Right.
And what was so funny in our situation, I feel like the doctor constantly was like, I don't want to overwhelm you.
Right.
And I was like, already there.
Exactly.
Like they try not to get you 15 steps
You're
ahead.
currently overwhelming me.
I'm like,
You're overwhelming
check
me.
that box. It's already done.
So
Like you almost need someone to come in, like if you're a couple, like a neutral person that can just like be like, do you remember what they said this? 'Cause it's just so hard because it's happening to equal.
Or just record it.
Yeah.
Is that
Yeah.
weird?
Yeah.
Record it. That might be brilliant. Actually.
So just a funny story. I was having a conversation with my doctor, actually, my REI, a couple of weeks ago, and we were going over, certain things from, previous protocol. And she was just going through all of this, medical, information and jargon. And I had a moment where I was just like, okay, yes, I follow. And then I'm like, can you say that again? Because, she's like, yeah, I was just going really fast because you understand this. And because sometimes it's like, and they can even make that assumption when you're in it for such a long time that you get it because you know the language, we've done the research, even though we say stay off of Dr. Google, we're still like looking things up. And I had that moment where I was like, okay, you know what, wait a second. I heard you, but I didn't hear you. And so she was able to translate certain things.
Yeah, gosh,
which takes some guts.
Totally.
I feel like sometimes people like on the other side, when you're struggling, it's like, that takes some guts to be like, wait, doctor, can you repeat that again? You know what I mean? Recording it. That's a genius.
I feel like it's so important too, to know when you're listening to something, but you're not hearing it,
Yes.
And I think
so
that
different.
happened to me all the time when cause I was so shocked all along. You'll always hear me say that I was just not really prepared for all of this. Right. So as they're talking, I'm thinking, wow, is this my life? That's really what's going on in my head.
Yes.
I'm not really, ingesting the medical diagnosis or information. I'm thinking, are we really doing is this really our story?
Yes.
So it's just interesting. I think I wonder, we could all probably do more work on just making sure that we're being heard and being listened to.
I'm not a fainter. I've never fainted in my life. And the first test we got back from Doug.
That's a weird thing to say. I'm not a fainter.
I've never fainted.
Is that a thing that people are fainters?
I've fainted.
Really?
Yes, I have fainted.
I've never fainted, I guess.
I knew, I've known people that fainted.
See, I learn things. We do podcasts. I learn things every time I learn something new.
Yes, but when we first got your diagnosis, which actually happened to be an error in the test, but the first error was, the first thing that was the results was Doug had 0 sperm in his body.
Yeah, 0 sperm count. Yeah.
And I remember the doctor talking, and I was like, oh no. Like I was like literally like he was going back and forth, and I was like, I need to sit down. And I've never, like, if that does not show how overwhelming it is, like that is not something that I struggled with before ever. And I'm in this doctor's office hearing this result, and I'm about to faint. Like that's just a test to how overwhelming it can be.
Very much so. Very much so.
I want to go back, if I can. One thing you said, do you feel as if, I guess this is a big question for all of us and even for us to think about, do you feel like infertility comes up at a really inopportune time in our lives? We start to notice that, for us, we were late 20s. We're also very career oriented, and maybe it's just us, we're out here in California, but we were very career oriented, very much so thinking about this life that we wanted to be developing. And then on top of that was, now you have this whole other thing to introduce into your life. And it added to the stress for us.
Definitely. So many messages that we get growing up, it's like, you follow a certain trajectory. And so for some people, it's going to college or going into a trade school, finding your partner and getting married and then starting your family. So, for those of us who are in school for, 57 years, that process gets delayed. So I've kind of called myself a late bloomer because, going through a master's degree and then also a doctoral program, which, took me about 7 years. I moved in between and then had a lot of life experience in between that. But, your life is on hold when you are trying to build your career. And so you have a certain idea of the foundation you want in place for a family. And then sometimes it's really hard to figure out, what time isn't on your side at the same time.
Right.
And really reconciling that, all right, fertility may have been at its peak in your 20s, but, just feeling ready to have a family at 25, it's like, oh my goodness, it's just a baby then.
Yes, totally. Your brain just developed 2 years ago.
It just really
fully developed.
Seriously.
At 23.
Exactly. Yeah. And so to, bring another being into this world and try to shape it with any, sense of presence just was so foreign to me.
Mm-hmm. Right.
So, I always, feel like, 35 is just like the new 25.
Yeah,
and,
totally.
Totally.
So,
100%. So you mentioned your infertility journey. How did that begin? Tell us a little bit more about that.
So I, met my husband and we were just having a blast, just doing us and then
riding motorcycles,
riding motorcycles and
I love that.
hitting up the breweries.
Yes, I love it.
Or doing some wine tasting. But we would always spit. And
Totally.
Yes,
Same.
yes. And so it wasn't until about 6 months after we got married where I was like, okay, well, I've never been pregnant, never worried about, I guess I should try to start. And I thought, naively, I thought it was going to be easy. The first time I got pregnant the second month we were trying. And so And I was like, "Oop, here we go." And so scheduled my first exam, and they passed me off because of my age to the maternal fetal medicine doctor, because at this point you're considered a geriatric pregnancy. And
That
I'm
word.
like,
Can we change that word?
Can we
The
change
worst
yes,
name.
The
The worst name.
It's like, might as well come in with a walker
Seriously,
or something.
Seriously, that's a whole other episode around
Yes,
medical
there is.
jargon.
Yes.
Jargon,
Yeah.
excuse me.
Yep.
So, and then the first appointment was just, was a little tough because I knew, I very calculated, and I knew when I ovulated, and I knew when I was supposed to get my period, and I knew how far along I should have been. And the doctor was like, "Well, are you sure your dates are right?" And I'm like, "Yes, I know." And so, and I had some idea that this pregnancy wasn't going to be viable. And so, the second appointment, that's when we found out that the baby wasn't growing, and I had what's called a missed miscarriage.
Okay.
And so
the other day was the first time I had heard that.
Yeah.
Can you explain what that is?
So it means, I forget the technical kind of medical jargon, but basically, the baby's heartbeat stopped growing. Or stopped. Excuse me. There was no fetus. It wasn't growing, and so. And then at that point, they decided that I could either have a DNC or I could miscarry naturally. And being the holistic person that I am, and not wanting that much medical intervention, I decided, I was about 9 weeks at that point. So somewhere between 7 and 9 weeks, the baby had just not progressed, and I decided to miscarry naturally. And so they were like, "Okay, it's just going to be like a normal period." And that's what I prepared myself for. Still did some research, and that's kind of what I had found in a lot of that search. And it was anything but. So it was pretty, and when I use the word trippy, for me, there's a dissociative kind of effect happening where I realized that my body is still holding our baby that's not living, and it hasn't released it yet. And it was just so weird. So there's this weird disconnection kind of happening. And, and then the miscarriage process was actually incredibly traumatic, which I was not prepared for.
Of course,
And I started having what I imagined to be labor, and no disrespect to women who have actually gone through labor. It's the closest thing that I could imagine this feeling like, because I've had cramps before. I've got fibroids. I've had fibroids for 15 years. I know what cramps are like. This was beyond, to the point where I was, just writhing on the floor, and just so scared, but just, allowing myself to go through this, because this was what was happening. It was time to kind of pass. So I passed my child in the most dramatic of ways. And I need a little bit of time to really, process that. We talk about miscarriage, and I'd heard other women, go through it. It wasn't I had clients go through it. It wasn't something that was foreign to me, but the fact that it was happening to me was just a huge shock. And kind of threw me into this weird kind of grief space where I didn't really realize what was happening. And here I am, I'm a therapist. I work with people who are dealing with this.
Yeah.
And somehow, I have this idea, because I have the tools, or I know what to expect, that somehow I'm immune to the feelings or the impact of this. And so that was my first kind of introduction into the humanness around, alrighty, nope, you're going to go through this too. And so I was dealing with the triggers of, there's another woman who we knew in our circle who just had a baby not too long after my loss. And so, I went through a few months of really grieving and, dealing with the triggers and seeing babies and not really not fully appreciating, wow, it's because you've gone through this traumatic experience.
Right. What did that feel like? What were the emotions that come up? And when you mean grieving, what does that look like?
Yeah. So initially it was a lot of shock, And then not just anger that my baby wasn't here, but I was angry at myself for having the reactions.
Oh, interesting.
Yes, I was angry at myself. I was angry at other women who had their babies, who, and I didn't know what their stories were. And, so I was having these, irrational thoughts, and my therapist was just like, just calm calm down. Not calm down. She didn't say that. But just like, you're happy. This is human.
Yeah.
This is human. Just because you're a therapist doesn't mean that you get to not feel this. And I'm like,
right.
So that was a lot of my work because, I just feel like I know this. I should be better at it.
Yeah. I wonder, what does that feel like when you know the behind the scenes almost, right? You know why you're feeling the way you're feeling. You even maybe know how to treat what you're doing. And what does it feel like to have that type of perspective?
It's a very different perspective, and there's a realness that goes along with it. And so clinically, what starts to happen when I'm noticing that, and I take it back to my own therapy.
Yeah.
And that's what I did. And so having that space was really helpful. And at some point in my journey, I did add a support group after my second loss. Which was probably even more traumatic. And I didn't even get a chance to grieve that until I was probably I didn't get a chance to grieve it fully until I was, through that particular loss and then IVF and all of that. But yeah, it's there's a way of being in it that, that just makes it different. And so you have to and so it's more of a grieving process of, you're dealing with the shock and all of those feelings that are associated with the loss. And then, just allowing yourself to lean into it in whatever way. And then because I'm a therapist and responsible for other people's emotional well-being, that was my, my priority and discussing, okay, what does that look like in with my clients? And so I did have to make some choices about who I would work with. And then unfortunately, sometimes I couldn't help who came in my office. And I can't say to somebody coming to me for anxiety or depression. And then there's, we get in and we build this relationship. And then I find out after a couple of months that they have a huge infertility, journey that they just didn't share an intake because that's not where they were. But
sometimes they don't even realize
it. And so it just kind of came up. So that kept me tethered to the community in a way. So yes, my own therapy was immensely helpful, to this. And so, yeah, I think that's kind of what that was like for me.
I have a question of, what is that like to be struggling with infertility yourself and then have a client come in and say, oh, I've been struggling and now I'm pregnant.
Yes.
What does
How
that
do you
feel
do
like?
that?
So back then I didn't do it very well.
Okay.
Just quite honestly. I've had clients get pregnant after, during this window. And there was probably about a 5-year period of time where I just really, I was struggling with infertility. And there was 2 years that was probably really bad. And could tell you all about that. But during that period of time, it wasn't easy. I would, in session be happy. And, and this is one of those clients that had been with me for a while. So I can't just, say, sorry, I can't work with you or refer you to somebody else. That would be more damaging in the relationship. So I had to figure out a way to compartmentalize. So I, do a lot of prep work to be present. It would take a lot of energy and I'd feel drained and I'd felt angry and sad. And then I'd go cry, after a session. And I'd be crying in my therapist's office around it because that was still part of my grieving process. And, I wanted to be done with it and through it so quickly, and and I couldn't. But fast forward now, and I think we were talking at one point about what it's like to feel a little bit less triggered and kind of being on the other side of things. And I talk a lot about being on the other side of grief, which was kind of my coming out on Instagram last year. I was just like,
we're so glad you did.
Oh my gosh,
I didn't even know I needed you,
Seriously?
and I needed you.
Oh my gosh, I just love. I would just think about that Diana Ross song, "I'm Coming Out." I want the world to know. That's like my theme, because I felt reborn, to not be under the veil of heaviness day to day, of just sadness and despair and hopelessness, and yes, there were some happy times in there too, but it was like the heaviness was outweighing the lightness. And that was the first year, my birthday, that picture that I saw for my birthday last year. My husband was just like, he's like, why are you grinning? I was just cheesing, I was cheesing, and I was like, babe, this is my first birthday in 5 years that I feel happy. Wow. It was my first birthday since that second loss. And, and for those of you who don't know, my birthday usually falls around Mother's Day. Yeah.
You've got a lot of doozies in your life.
Perfect. Great. Yeah.
Perfect time.
So I was born the Thursday before Mother's Day, but and then there's some times where my birthday is actually on Mother's Day.
Oh my.
And so
My birthday's on Easter sometimes.
oh
I
my
thought that
gosh,
was terrible.
So never imagined that I would struggle, with celebrating my birthday until I lost our second pregnancy, which was my son that I carried to, or our son, I carried to 15 and a half weeks gestation.
Oh, wow.
And so,
Can we talk about that?
yeah,
Can we talk about that?
I'd love to talk about him.
Good. We want to hear about him.
Yes, his name, I just started to say his name publicly for the first time. Only a handful of people knew his name until this week, but his name is Xavier Francis.
Love that name.
Francis.
I love that name.
Yes.
That's
So,
beautiful.
As soon as I found out I was having a boy, as soon as I found out I was pregnant, I had boy names picked out, I had girl names picked out, and Xavier was
Love that name.
was
love
my
that
first
name.
choice. It's a family name.
Oh.
And so, yes, his name was Xavier Francis. And so we were really excited about him. And I was at a point where after my first loss, I had gone through some issues with fibroids. Like I said, I'd had those for like 15 years. Had another fibroid surgery to remove them. And at that point, the doctor was like, you need to get pregnant now, and that was a pretty ominous message. But still just doing what I did, tracked, my cycle and did, was the good little patient, got pregnant in a few months after I got the go ahead to start trying again. And so I thought, okay, here we go. This pregnancy is really going to work. But again, then I was thrust into the world of, the anxiety that comes with that, with being
Right.
pregnant after loss.
Right.
People think, oh, pregnant, fixed it all.
Exactly,
Right.
exactly. And even though, again, I knew because of working with women, it was just so different, again, experiencing it for myself. So for me, my anxiety shot through the roof. I mean, from a clinical perspective, it was pretty intense. So
How does anxiety show up for you?
so for me, because I was so worried about spotting, I literally was going to the bathroom probably like 10 times a day just to check for spotting. Any kind of tweak or, sensation of
Right.
moisture that
Yes,
I felt was like, oh my gosh, is this blood?
Right. Was there like a waiting for the shoe to drop, or what's
Yes.
that saying? Like waiting for you're expecting it almost.
Exactly. And so I was kind of expecting it, nervous about it. I was asking for blood tests to confirm pregnancy. So even though I saw my HCG levels rising, and my doctor was like, "Oh my gosh, your levels are sky high." Whenever I would see the sense of spotting, then I would push for a test, or like, "Hey, is this still real?" And just to see where my levels were, because if my levels were dropping, then I knew. So that was my way of trying to figure things out.
I think it's interesting with anxiety because I think sometimes people think anxiety is just, I'm just a fidgety person. And
Right.
it's like anxiety can be going to the bathroom.
It's going
10 times a day.
Exactly.
Smells, all that kind of stuff.
Exactly. It can come out in so many different ways. So for me, it was checking.
Yeah.
And so the other issue that kind of happened with that particular pregnancy is that they did my first trimester screening later. They were it was almost like I was approaching the 12-week mark, and they're like, ooh, I think I was at 11 weeks by that point. They're like, oh, we need to do your first trimester screening, which they normally do, I think, around 10 weeks, 9 or 10
Was
weeks.
that on purpose or just accident?
No, just accidental, accidental. And so I made it past the 12-week mark, which I was like, whew. And I know that's it's still an arbitrary, marker in terms of milestones. But for me, that was the longest that I had, gone. And so I felt like, okay, I have a good chance. And then I got the dreaded phone call. And so it was Monday, September 23rd, 2014. I was driving home from work at night, and my doctor called me at 8:00 at night. And I was about to go in for my NT test the following day. And he said, I need you to pull over. And I was just like, what? Like, I mean, I can talk, I'm driving, but it just didn't compute. And he's like, well, let me know when you pull over. So I was about, I'm going to cry.
It's fine.
That's
You can
okay.
cry.
We all might
You can
cry.
I will cry.
So I pulled over, and that's when he told me that something was wrong with our son. And I just had this moment where I was just like, okay, but it's not real. It's not real.
Yeah.
And people tell you that even though you know, when you get older, that you have, you know, a higher chance of there being a chromosomal issue or something like that. I still did the calculations. I was like, this is still kind of like 1%, you know, it just, and then that, to be in that small a category was just like mind boggling. And so he told me that, and I just sat in the car. And luckily I was just probably a few blocks from home. And so I drove, but I called my husband and I said, Michael, something's wrong with the baby. And he's like, what? And I said, something's wrong. And I told him what the doctor said. And he's like, are you sure? And so it's like, yeah. And so I drove home, and he's waiting there with like to hug me, because he's so like, he's so wonderful that way. And so I hugged him, and then I went straight to the computer to do some research, of course.
Yeah.
Because priorities. And he's like, hello.
Like, no, you can wait.
I need to know what's going on.
I need to know what's going on.
Yeah.
So, we sat and we talked, and he held my hand and just rubbed my back as I was like on the computer. And I immediately reached out to a couple of my friends who were doctors, just to kind of get their insight as well. And then I went in for my test the next day, which was just a complete and utter crapshoot, because, I'm having to, normally I was excited to kind of look at the screen, and then I remember like not even wanting to look at the screen anymore, because I just felt I started to disconnect. And so the test confirmed that there were some issues, and the NT test that what they measure for was just kind of off the charts. So we knew, and so from there we talked with geneticists. We were looking at possibilities, and it just wasn't good. It just wasn't good. And so we had to really think about going to term, if I could make it to term, because there were so many things that could happen with our son. And then if we made it to term and if he lived, this is what we would face. Yeah. And that was the most heartbreaking of situations that I don't wish on any parent. We made the painful decision to not continue with the pregnancy. And we felt good about it in the sense that just basically having our child be born, and potentially, or not potentially, but to have, or if he were born. I mean, there were so many ifs. Yeah. We just couldn't take that chance. And then the quality of life that he would have had, and it just was too much for us to bear. So we decided to not continue, and we didn't tell anybody the reasons why, because we have, and we have some people who are very supportive of choice, and in our circle, and then we have some people we weren't sure about either. Right. And so we had to be very careful about that. And one of the things that I found when I was looking for support, that there wasn't a lot of support for women who had gone through what's called a termination for medical reasons. And again, can we talk about the medical jargon? Because this whole termination thing,
termination, like that sounds like
and
it sounds cruel.
It sounds cruel.
Yeah.
It sounds cruel, and
or suffering or something.
Yeah, and we just felt like that was our decision as parents. You know, we would rather have the burden of dealing with whatever heartache as opposed to our child going through whatever burden or heartache of whatever few days he would have lived, or and what that would have meant. Yeah. So.
And the community thing that stuck out to me, of like, whatever your view is, say pro-choice, whatever, this person is hurting. Yes. Like we could be better at that. We could meet them where they're at. Like there's no reason that you should not share with those people in your circle. Not saying that they're doing anything wrong or whatever, but it's like, or they should be judged too. But if we can just like take your personal view out of it and just care for you, that you are a hurting person and no judgment and just care for you and meet you where you're at. Everyone could be better at that.
Everyone. Yeah.
And
no matter what your view is.
Exactly. And just focusing on that, because I will tell you, when I brought this to my online group at that point, because at that time there was only Facebook, there wasn't Instagram or anything like that. Yeah. And there were so many women saying, no, don't do this, you know, and so they weren't really honoring what our choice was and why we needed to make that choice. And so there was some veiled judgment there. And then once we decided to do that, and then I had women inboxing me, and, you know, and that wasn't helpful either. And that pushed me even further down into it. I just felt like, you know, this dungeon, and, And luckily I was able to, I don't know how I found, there was a website at that point called A Heartbreaking Choice. And it was dedicated to women and couples who had losses for medical reasons. Oh, yeah. And that was a place where I found other women and was able to connect with them, but we still weren't mainstream. And in some ways we're still not mainstream.
I would say it's still not.
It's still not mainstream.
Infertility is an onion. We're just going to be like, okay, we're talking about infertility. That's one layer. And then now we got to break it down to all these different layers. So thank you so much for sharing.
No, thank you for listening. Yes, it feels good to talk about him.
Yeah.
Good.
It's just fascinating to me because from a perspective of not knowing enough about infertility growing up, the more you learn about it, the more you realize. And part of the reason why we're doing this podcast and what everyone is doing in the infertility community is so important right now is because it takes a long time to get down to these stories, but these stories matter. Your story matters because someone right now is in this exact same position and they have no idea what it feels like. Yes. And maybe for the first time they've been validated and they've heard what it feels like.
Definitely. I hope
your bravery is inspiring.
Thank you.
And it will help people 100%.
Thank you. I hope so. It took a long time to get here, but it feels so good to be here.
And that's okay too.
It is.
It's okay.
It is.
That's okay too.
Yes.
So what was that like after that season? You lost your son. What was that like?
Didn't get a chance to fully grieve because of, I think I took a few months off, and then it was just, I think we took a trip and
everybody does it.
Out of here.
Get me out of here.
We have so many sad trips. Yeah. We went to Napa and was a sad trip.
Sad trip. Yes. Yes. We have what now I call, affectionately call our grief tour.
Yeah. Oh, I love that.
Yes.
I love that.
We should start selling those grief
tour gifts too.
Yes.
We have grief gifts.
Yes.
We bought a vacuum one time, like spontaneous. We already had a vacuum.
Target.
I was like, I want one of those. Just bought it.
After our second adoption failure, literally walked into Target. It was $450. I was like, I don't care. Put it on the cart.
Yes. Exactly.
And now we call it our sadness vacuum.
Yes.
And we have a 900 square foot apartment and we have 2 vacuums.
I love it.
But one's cordless and one's not, because you never know.
You just never know.
You never know what you need.
The things that you do after grief that you didn't do before grief. It's real.
Yes.
It's so funny.
Yeah.
So
you went on
a grief tour. Yeah.
We were on a grief tour, and sprinkled within that was, probably about 4 cycles of IVF. I did a MinStem, and then 2 transfers that translated into just 1 chemical pregnancy. And then at that point, I was just like, forget it. We're just going to travel for a little bit. I need to take a break. Yeah. Then I had this, then they told me, you know what, you're not going to get pregnant by yourself. I had 2 blocked tubes, and then I got pregnant naturally, without assistance. I don't want to stigmatize having assistance. And then I thought that was going to be our miracle, and it didn't. So, I mean, so after that last loss was when I think I really was able to get more into grieving and traveling as a way of helping to have some sense of normalcy and give me a reprieve from the intensity of grief. So each trip is actually a nice little point in my healing journey. And my husband was just kind of like, all right, where are we going now? And he was up for the up for the journey. So it was the time after that though was pretty cloudy. But I think allowing myself time, which was really frustrating too, because when you're grieving, you just want to be done with it.
Yeah.
You're tired.
You're tired.
Yeah.
It's exhausting.
So true, yeah.
It is exhausting. You just want to sleep. You don't want to do anything.
Yeah.
You're feeling a little depressed, but then there's certain things that kind of keep you going, and you find those things to keep you going, and then you find your way, and then you can learn that you can turn a corner with this.
Yeah.
So,
And what was that like, turning a corner?
liberating. It was liberating. I was so lucky to connect with another therapist who had also who lost her child to, for chromosomal issues as well. So she went through another TMFR or TFR. You know what I mean?
Yeah.
And because for me, I wanted I was like, okay, what is this like for another therapist to go through this? And so she is still, we text each other regularly and get together, and shortly last year, I shared with her, I was like, wow, I feel like I've turned a corner. And she's like, yeah, me too. And so I've had her along the way to provide that support and know that, I can share with her any issue that I'm struggling with clinically or personally about how this shows up in my life. And she really gets it. And so, and we talk about, being that community for each other, and wishing that we had a bigger community, but it's nice to have each other. And so it was.
Would you say the turning of the corner was finding community, or what did that look like? So you're on this like foggy road, and then now it's like turn that corner. What was that corner?
So the community around medical terminations is still really small, so I can't say that it was finding that sense of community. But for me, it was really more about coming to a sense of peace within myself, of knowing that I did the best that I could. I tried as hard as I did. I can never say or look back and say I didn't do. I can say certain things, but I know that everything that I did was what I knew. I did the best I could with what I had at the time.
Yeah.
And I can say that with certainty. And that felt really good. I just felt honoring my despair was just important. And not judging myself for the ways in which, the triggers may still show up or they don't, but at least they're not as intense as they were before.
Right.
I still have to be careful about, there are times where I will kind of have these moments where I'm really shocked about certain things, and I'm like, whoa, I didn't expect that. But the moments don't last as long. Yeah. And when I realized that, it's like, okay, I know how to ride these waves now.
Right.
And learning how to ride the waves that was imperative for me in moving forward. And also knowing that there are other possibilities out there too. So I think that opened up a little bit of space for me. And so I'm hoping that, for the women who have gone through, just these heartbreaking choices, that they can find that community here, and know that they can talk about their babies, and talk about their experiences and not feel judged. Because of what you had said, and I say that when I meet with my clients, and I can tell when they're feeling a little bit self-conscious, and I'm like, hey, the world is a big, bad, scary place, and there's a lot of judgment happening out there.
Yeah.
And if there's anything that we can do to, what I try to do is like, we're going to take that proverbial bat that we use to beat ourselves up, and we're going to leave it outside the door, because there's enough of that happening out here.
Oh, that's good.
So good. So I can hear anything, there's nothing that shocks me about what women kind of share. And so that's what I mean about, just that's what I found in my therapist friend, it's just letting somebody else witness those ugly parts and be like, oh yeah, girl, me too.
Right. You're like, okay, good.
Yeah, that validation, right?
Yes,
yeah, totally.
One thing that I was going to add is, I don't know if it was helpful for you, but I have never been pregnant, but I still gave my infertility a name. So it was helpful for me to focus. Like my name was Ruby, because my grandma's name was Ruby. And so I always wanted, and since I was like, me and Doug got married, I'm like, I love this name. I want Ruby Ray, because my middle name is Ray. I'm like, that's what I wanted. So that has been really helpful for me. And sometimes I've given advice. I'm not a therapist, but I've given advice to people that have reached out to us of like, how, like, I just had a miscarriage. And I always say, I'm like, I think it's helpful to have a name or something that you can like focus on that. I'm like, well, don't name it something that you want to name your another child. You know what I mean? Because just have that name be something special. So I don't know if that was helpful for you. It was really helpful for me to have a name tied to it.
Interestingly enough, and I think it goes back to, I think my willfulness, I'm going to call it willfulness.
I like that.
My mom might call it stubbornness, but I'm going to call it willfulness around naming it, because I did hear that. And I have encouraged women to do that. And there was a reason why I was so reluctant to say Xavier's name for so long. And so saying his name has been healing. Saying it more publicly has been healing, and not just calling him X as I did.
Yes, exactly. Because then it makes it feel like, oh, it's not personal.
It's not personal.
And it's like, no, it's very personal.
It feels like you're making it really part of the grief process. You know, you're really bringing it in and making it something worth it. What always was worth grieving, but it's like you're acknowledging that. Yes, I'm gonna grieve this. I'm gonna.
Yes.
Yeah.
So I need to change his Christmas ornaments now from X to Xavier.
Yeah, there we go.
I mean,
I love that.
So but I do. That is a beautiful, I think, gesture to humanize that struggle and allow people to honor what that was, could have been. And allow them to go through that loss as healthfully as they can.
It adds so much more personal. I love it.
Your resilience as a person is so amazing. Honestly, really, like to the grief that you've had to go through and you've allowed yourself to feel, and the community you've made is so amazingly impressive.
Thank you.
I want to talk about an article that you wrote about infertility trauma, about racial trauma, to not only add another layer to this onion, but we'd love to know, what does it feel like to be Black in the infertility community? What does it feel like to have that other layer of things that you have to contextualize in terms of disparities in the medical field, disparities in culture and society, and in representation? Please fill us in. Like let us into that. What that
everybody
feels like.
Listening.
Listen.
Get out some notepads.
Listen to
listen
this.
and learn.
So it's. I started when I became a patient in the infertility community. There was still this idea that infertility was mainly something that impacted white people, and there wasn't a lot of conversation or thoughts about how it impacted communities of color, in particular Black people, Latinos, Asians, Native Americans, or Native Indigenous people. So I even heard a couple of times, that this idea, oh, you're Black, you're fertile. And so that was this, narrative that I walked into this journey with too, thinking, all right, well, I'm fertile, I'm just going to do IVF and get pregnant. And, just there's so many naive things.
I think that's an unhelpful stereotype that falls upon anyone who, maybe we would classically say as like a minority, right? It's like, oh, they're such fertile communities, which is just not true.
I think when you're even
true.
in the community, you could think that.
No, absolutely.
I mean, across the world, across the globe, people on average have about 3 kids, no matter where you're at, and I think it's just an unhelpful stereotype that we cannot get out of our heads.
No, we can't get out of it. Get that out of our heads. Yeah. And then when you think about what goes into creating that stereotype and the historical issues that have been impacting the Black community in particular. So when you think about how we were treated during, the enslaved times, or the times in which we were enslaved, and the gentleman, or the doctor who was in charge of like discovering gynecology probably didn't really like women very much. But anyway, Dr. Sims used enslaved African women to experiment on. So, and he was the one that created some of the technology that doctors are using to examine us. So that, that's speculum. Hello. That is like a remnant.
Torture device,
basically. So when he was performing these medical procedures on women without anesthesia, and that was because he thought that because, we were who we were, that we didn't feel pain. And so the fact that, that you didn't care enough and we were considered objects at that point, those are just some very early moments that really, I think, highlight how we were treated and how we were perceived. And to this day, there was a study, I think in 2016, coming out of the University of Virginia, where if you interviewed a certain number of doctors, they still believe that Black patients do not feel pain in the same way or as much as our white counterparts. And so how that translates is like when people are experiencing pain in the hospital, they're less likely to get, pain medications, things like that. And I can actually attest to that, or I can attest to that because of what I've seen with my mom. And I know that we talked about this off of the podcast, but my mom has a chronic illness. Yeah. She has sickle cell disease, which is very common more common in the Black community. And people assume, and doctors have assumed along the way, that she is drug seeking. So that it's a very real reality. And then when you have a specialty like, infertility, and you don't have doctors that look like you, and you have doctors that might have the idea, or people that you interface with that have the idea that infertility isn't an issue that impacts your community, it leaves you feeling even more isolated.
Yes, and infertility is already isolating.
Yeah.
And then that adds a layer.
It adds another layer. So going through this and hearing from some of my Black friends, well-meaning Black friends, you're fertile, you've been pregnant, you're fertile. And I'm like, well, that's not helping me right now.
Right. I'm not right now.
And, and so it just felt even more kind of defective. Yeah. And so the distrust that we have in the medical community that's born out of this early treatment, and then that has continued on. And then we've got the Tuskegee experiment, where you have men that were not told that they were being injected with syphilis, but doctors just wanted to see how the disease progressed. And so we were considered human guinea pigs, or Henrietta Lacks. So if you've ever been, or worried about being diagnosed with cervical cancer, you can thank her, because they actually stole her cells without her knowledge. And she is now living outside in these laboratories because of that, and her family has not been compensated appropriately for that. But the medical community has, and they've made billions upon billions of dollars based on her DNA. Wow. So
what does that feel like?
It's incredibly enraging. Yeah, it's enraging. And when we talk about the disproportionate ways in which Black people have access to medical treatment. And then you have some people saying, oh, well, we're all equal, and, everybody has a shot. And it's like, no, we don't. Right. We were enslaved for 150 years, and then we had some laws, and then Reconstruction, or
150
right.
And that's just the tip of the iceberg. I mean, that's like, then there's Jim Crow laws and everything.
150 years.
Right.
That's
and not even just that. So you have that, and then you've got Reconstruction, and then Jim Crow laws. Yeah. And then to think about it, we were only, given the right to vote. We only had full citizenship about 50 some years, maybe
which
50
is
plus
so
years ago.
Not that long ago.
It's so not long ago.
No.
So this whole idea around equality and thinking that people have equal access is not true. And so
I think that goes back to what you were saying, or what I have heard is infertility affects everyone. Right. Which is, it's true. Right. And infertility can affect anyone, but we may even be tempted to think, well, it affects everyone proportionately, which is not true.
It's not true. It's not true. So Black women, at least from what we can tell, Black women are going to be twice as likely to experience fertility issues as our white counterparts, but about half as likely to access treatment because of it. And so the data is less clear about what that looks like for the Latinx population, or the Asian or indigenous populations as well. But I
even notice it in religions.
Yeah.
If you are Mormon, you are
less
fertile, like been told that you're fertile.
Yeah, that stereotype exists.
Yeah, that stereotype exists even in religion.
Yes. So
what does that, just take us just briefly, when you start to realize, okay, I'm struggling with infertility, and you come from a community that is more disproportionately affected, I know you said enraging, but tell us a little more. What does that feel? Does it feel like I now have an extra mountain to climb? Where does your mindset go?
So my mindset goes to a couple of places. Number one, if I think about the larger infertility community and I don't see my story represented, I see just stories of, white women being shared, and it leaves me wondering, is there a place for me in this? It feels really isolating. And then when I go to the Black community and you hear, oh, you're fertile, or, it's like, that's isolating as well. So, having to create, it's like going to different communities for different things at different times. So it's felt disjointed. I think it's the best way.
That's a great way to say it, disjointed.
It's been disjointed. And I think that they're like, Erica McAfee from Sisters in Loss
Love her.
is doing a lot to create more community, and I think we're trying to do more of that. It's just not where it needs to be, and it's growing. It's growing, but it's disjointed for me as well. And I think disjointed carries over too, because I am a therapist. And so I realize that, working with a lot of people in the community, I feel disjointed for a different reason, because, it's hard to seek support from the very community that you're trying to support. So I have to be, ethically, I do have to be a little bit different about how I carve out those niches for myself in that network.
Right.
Mm-hmm. Yeah.
So
I have
powerful.
a question. I know. I have a question. Obviously, we don't have brown skin. Obviously.
We don't.
We look a little
if you're watching this on
If you're
YouTube.
watching this on or listening to it on podcast,
this is
surprise. How can Doug and I be better with the platform that we have? What can we do? Is it more representation? Is it more we need to talk about it? Is it what does that look like? How can we learn from you on how to do this better? And I don't want that for you, and I don't want that for any minority to feel that way.
Yeah.
And so, but sometimes I feel like, I don't know, it's getting personal here, but it's like, I sometimes I feel like I don't want to offend anyone, not of my race, but like the other race. Like, you don't know what you're talking about.
Right.
You're white. Like
Right.
you have no voice. And I'm like, I'm trying to do it, but I'm trying to do it respectfully, and I don't want that to be something in my head that's keeping me back of like, someone of that minority looking at me going, you don't know what you're doing. You have no say in this. Does that question make sense?
No, it does. I think you all as white individuals have a lot of power in advancing the conversation around the disparities. So, increasing awareness is important, and representation is definitely important in making sure that that all the stories that you feature aren't necessarily that of white individuals, which I know you already do, and I think when you bring that and live that, you're going to be doing that in your everyday world as well. So who you talk to and raising awareness with those individuals. And then it becomes this kind of web effect that, because that has been something that's on your mind, when people talk about the fact that everybody is equal and, we operate in ways that, that equalize people. And it's like, no, we don't. And so it gives you an opportunity to challenge that, I think, in a very real and human way. So it's part education, but it's also staying in relationship and using your other relationships to advance that message in whatever way makes sense.
Yeah.
So
done.
I think
I'll do it.
Yeah. I think a lot of the issues that come up when it comes to race are because we're just always unwilling to face reality.
Yeah.
We're continuously wanting to turn a blind eye to what's really going on, whether that's in our country or that's a little bit too broad, but I mean, but in the infertility community, we need to really see it the way it is instead of the way that we want to see it, or from our perspective. And if the Black community is disproportionately affected, then a disproportionate amount of our stories should be Black stories, because that's what's going on.
Right.
And I feel like we can't be afraid to tell it the way it really is,
Yes.
and really be passionate about finding the way it really is,
And you just said something that I think is important. It's like, we can't be afraid to tell the stories.
Yeah.
It's leaning into that fear, and, and it's using your privilege to be able to do that.
Yeah.
Yeah.
Doug and I say that all the time.
Yeah.
We're like, oh, look at our privilege.
Yeah.
That we could just do
totally.
that so easily. Like, that's something we talk about a lot in our
I think
our house.
me and you, we could fight to find reality more and not be afraid to tell things the way they really are.
Yes.
Even if it's a bad story, even if it's racist, even if the system is racist, we got to talk about it, and we got to tell what's really going on.
We have to, because pretending that it doesn't, leads us to kind of what's happening. And
And then you
areas.
then you have the invalidation thing going on, right? Where it's like, I feel isolated because no one's really willing to tell it the way it is.
And then we're enabling the system that continues to disenfranchise Black people, or disenfranchise, Black people within the infertility community. And and we don't want to continue, to contribute to that. Yeah. So it's important to continue to advance the conversation, for sure.
Absolutely.
Yes.
It is such a blessing to talk to you. Seriously.
It is an honor to talk to you.
You are a wealth of wisdom, and I just gleaned so much from you.
I feel like we always talk about our takeaway. Or
Yeah.
my biggest takeaway was actually something that I'm honored to hear your son's story and your whole journey. That was very honoring for me, but to listen to that. But I think my biggest takeaway was I knew that they had practiced on people that were enslaved, like the medical thing, but to think like the tool that they used could be traumatic for someone going in the doctor's office. Like I never would have thought about that. So thank you for sharing that and bringing that awareness to me.
You're welcome.
That was a big takeaway for me.
Yeah, just hearing your story just makes me think that infertility is so isolating. It isolates us in so many different unique ways, whether it's a obscure diagnosis or an obscure situation that, within the group that not a lot of people think about, less people even think about that one thing, like the situation you found yourself in. And then the racial disparities, even within that, there's so many different avenues in which we could be isolated. So we need to continue to fight to tell one another stories and be friends. Just be friends with more people in the community and more people like who are not like us, who don't have stories like us, to see the world from their perspective. So I hope for our listeners that this conversation did a little bit of that, help you see the world from a different perspective. From our perspective, from Dr. Loree's perspective, if you're uncomfortable, that's probably good. That's good.
Lean into it.
Lean into the discomfort.
Exactly.
That's right.
Just lean on in.
Well, more from Dr. Loree in the future, hopefully.
Yes, we would love to have you on again. How can we find you? If a listener wanted to find you, how do they find you?
Yes, so I'm on the gram at
I'm
on the gram at Dr. Loree Johnson, and that's DrLoree, and Johnson common spelling, or my website is drloreejohnson.com.
Awesome. Thank you so
Thank
much.
you so much for
I hate to bring this up, but I got to bring it up one last time. We got to see a picture of Purple Rain on the internet soon, right?
I will.
Yes, I want to see that. I will story that.
The majority of your followers, there's no way they know you ride motorcycles, right?
I think I might have shared something about that during Infertility Awareness Week, but
dang it, I must have missed that.
It's okay. It's okay.
Amazing.
It's okay.
I love it.
I like talking about her, so I'll bring her back out for you guys
perfect.
to see.
Perfect.
Thank you so much for being here. Have a wonderful rest of your day. Yeah.
Thank you. You too.
Bye, everyone.
Bye, everybody.